Hello, friends. I am Dr. Anil Ganjoo, a consultant dermatologist practicing out of New Delhi. Today, I talk about a very common condition that is on the rise over the last few years, the fungal infections of various parts of the body and the tips to prevent them. This comes to you on behalf of Derma Vidya, which is a platform that has been developed by Alembic for spreading information amongst the dermatologists and patients alike to improve the treatment outcome in most of the patients. Now, fungal infections in the recent past have been on the rise. We see a very huge number of patients coming in with this problem. And not only the patient, the families at the same time, and even the localities which have close environments, they have this infection happening commonly and difficult to treat again. Although this rise in infections or recalcitrance of fungal infections is not primarily because of resistance to drugs, but there is definitely drug resistance causing this recalcitrance. There are many other factors that have been leading to increase in fungal infections, which includes change in lifestyle, use of tight-fitting, heavy clothing, the gene culture, tight-fitting footwear. All these factors have led to increased fungal infections. The common types of fungal infections have been classified according to the area of the body that they involve. So we have tinea capitis, which involves the scalp. Then we have the tinea facie involving the face, fungal infection of the face. We have the corporis involving the body. We have the cruris, which involves the groins. We have the pedis, which involves the foot. Then we have onychomycosis, which involves the nails. So depending upon the area of the body involved, we have different types of fungal infections. But over the recent past, as I've already told you, these fungal infections have become very, very recalcitrant, very difficult, and there have been new kinds of fungal infections happening in the recent past. So you don't have infection localized to one area. Now, large patches of fungal infection happen, and they can involve many, many areas in the body. Generally, we call it ringworm because it comes in the form of rings and the edge spreads. The edge is the most active part of that ring, and there is central clearing. So you have a ring kind of a thing happening. It's called ringworm. But lately the lesions have become more eczematous, more aggressive, very huge, large lesions. So all this because of the changing pattern of the fungal infections. And one reason also for this changing pattern is the changing causative organism. Earlier, we used to have most of the infections caused by Trichophyton rubrum, but there is a rise in a more aggressive, species of fungus known as Trichophyton mentogrophytes. The Trichophyton mentogrophytes, one is aggressive, is more resistant to treatment, and causes very, very severe disease and sometimes eczematous lesions also. The risk factors I've already told you, tight-fitting clothing, gene culture, not washing the clothing properly, sharing the clothing, towel, soaps, etc. All these. Use of topical steroids. The next door chemist many a time gives you the topical steroid combination and people apply it and then reduce the immunity of the skin locally. So the disease the inflammation may decrease for some time, but the fungus increases or infects in a more severe form very soon. So generally, it is easy to diagnose a fungal infection. The fungal infection, as I told you, comes in the form of rings and generally starts in the groins. So jock itch, as it is known as, these people have itching in the groins. And if we examine the area, it has a erythematous or red patch, and which generally has a edge. That is, it is a ring kind of a thing. So that's why it's called ringworm. It generally spreads, from close contacts, like if you have a family where there is sharing of bed linen, towels, sometimes clothing, soaps, etc. It can spread from one person to person, even can get the infection from infected seats of the toilet, etc. So to help you prevent this kind of transmission, you need to be very careful about your hygiene. You need to wash at least twice a day, particularly on sweaty days in hot sultry weather when there is a lot of sweat collecting in your folds, because dampness and increase in temperature promotes fungal growth on the body. So when there is too much of sweat happening, there's too much of heat, take bath twice a day. And after bathing, it's very important that you dry the area properly. So use each time you take a bath, use a dry cotton towel which has been sun dried, and then dry properly, and then you apply your anti-fung cream. Also, as I've already told you, in the summer months, try and avoid heavy clothing. Try and avoid clothing that causes too much of sweating and makes the sweat stay on the body and tight fitting clothing is to be avoided. Woolens, synthetics, all these are to be avoided. Cotton clothing should be preferred. Tight fitting clothing, tight footwear, etc. should be avoided. Never share your clothing, never share your shoes. That can lead to transmission of the infection. And if the clothing, if you have somebody infected in the family, the clothes should be washed separately, preferably in hot water. Anything 60 degrees plus kills all the spores of the fungus. So otherwise the spores can stay in the clothing, and that can help spread of the infection. So the drugs plus these hygienic measures help you deal with this difficult disease to a large extent. I hope I have been able to give you some good information on this difficult condition called difficult fungal infections and its effect on our day-to-day life. If you want more videos on this or on any other skin conditions, please go to dermavidya.com, which is a platform developed by Alembic. I'm sure you're going to get a lot of information out there. Thank you very much.
For more such videos, visit or log into dermavidya.com.